Let's talk health now. Nigeria is witnessing another surge in Lassa fever infections, with health authorities raising concern over rising fatalities and increasing spread across several states. The NCDC says Nigerians must maintain hygiene to prevent further spread. There is more in this report.
Lassa fever, a viral disease first identified in 1969 in the town of Lassa in present-day Borno State, continues to pose a major public health threat in Nigeria. The disease, primarily transmitted through contact with food or household items contaminated by infected rodents, has remained endemic in parts of the country for decades. According to the Nigeria Center for Disease Control, a total of 413 cases have been confirmed out of hundreds of suspected infections this year, with 80 deaths recorded across 11 states and 63 local government areas. New infections were reported in 8 states: Taraba, Ondo, Bauchi, Edo, Benue, Nasarawa, Kogi and Ebonyi states, affecting 24 local government areas. 89% of these confirmed cases are concentrated in Bauchi, Taraba, Ondo and Edo states. As the NCDC continues its awareness, Nigerians are advised to avoid contact with rodents and their droppings, store food properly, maintain good hygiene by washing hands regularly and keeping surroundings clean. NCDC says individuals must seek medical care in case of fever, weakness, severe headache, cough and sore throat. The NCDC report also confirms new cases among health workers, raising concerns about infection prevention and control measures in health facilities.
Professor of Infectious Disease, Molecular Virology and Genomics, Oladipo Kolawole, joins me live via Zoom from Osun State. Prof, Lassa fever is back in the news. Help us break this down. Is Lassa fever indigenous to the African continent, and just how dangerous an ailment or infection is it?
Well, Lassa fever is not back. Lassa fever is not back. Lassa fever is with us. And the truth about it is that, Lassa fever got the name from a Lassa village where it was first identified in Nigeria around 1960s. And up to date, there is no favorable solution that has been given to this pathogen. And let me be sincere with you, the epidemiological studies have shown us that between November and May of every year, that is when we always see this pathogen emerging and see it being causing havoc that it has caused. And you can see that this year we have recorded more fatality rates than before. So to me, as an expert, I feel that we are not doing what is expected. We should not wait until we see this pathogen causing havoc before we start talking about it. The epidemiological data is there. We have known the period where it always comes forth. So we need to have sensitized our population well, because there is no vaccine presently for this pathogen, because all the vaccines that we have is either in clinical trial phase 1 or phase 2. Last year, we were in Abidjan by Lassa virus conference. I was part of the participant, organized by West African Health Organization on Lassa. And this is one of the major things. So Lassa fever is not new. Lassa fever has stayed with us, but we are never getting ready for Lassa fever.
So, Prof, why are we not getting ready? Is it just that we're relying on the West to help us out here? But then, considering that it's not a big deal where they are, how much attention are they going to pay to us? It appears it's high time we, held this and handled it our own way to save our people. What can we do at this time to help the situation?
Now, let me tell you that what we're doing as a country is more of clinical management than R&D. Because when I mean by clinical management, you get patients, you detect them, you manage them. Those who are detected early will recover. We have some that do recover. If you look at our specialist hospital in Edo, Irua Specialist Hospital or Lassa, they are doing fantastically well. But that is at detection level. And what we need to do, we need to invest. We need private organization that need to put down their money. That, Federal Ministry of Health even set up a committee on Lassa so that they can work. But all these committee, all this, they need enough funding. So we are waiting for the Western world to come and fund us through CEPI, or that is Coalition of Epidemiological, owned by, supported by WHO through the Gates Foundation. We are looking forward to WHO, whereas there are no mobilization of indigenous fund to support this thing. And it's so that this thing is mainly affecting West African countries. And Nigeria is the major hub for Lassa. So we need a task force that will be dedicated to research and funding for getting the vaccine, for getting enough therapeutics biologists that can solve this problem.
All right, so Africa and especially Nigeria must arise. But talk to us now as an expert. What should we as citizens know about Lassa fever? What can we do to prevent infection?
The most important thing that we need to do to get rid of the infection is getting rid of rats in our community. Now, if I talk as a scientist, that is this kind of rat, but you can't be looking out for rats and be looking at how many is mastomy species. So how do you want to identify it, but get rid of rats? The important thing is sanitation. You discover that most of the local governments that this thing has been found are poor sanitation are existing there. And that is why it's very difficult to see Lassa in urban. Where you see it in urban, it's mainly going to be human to human transmission, whereby somebody is infected in a local village and is now being brought to the city, where it can now become a hospital-acquired infection. If the healthcare worker did not know on time that it is Lassa, because it's going to present itself like malaria, fatigue, high body temperature, and not all our hospitals have the enough diagnostic tools. It's only some specialized hospitals. Now we're talking about rural areas that the pathogen is emerging. They don't have all those molecular tools until they get back to the city where they can be detected. And at that stage, the disease would have advanced in clinical stage, where it will be difficult to manage. And that is when our healthcare workers can now pick it up as infection.
And indeed, in recent times, they have been bearing the brunt of it. We hope that we arise and deal with this. Associate Professor of Infectious Disease, Molecular Virology and Genomics, Oladipo Kolawole, thank you for your time on TVC News at 7.
Thank you for having me on the news. Thank you so much.